Hello, my name is Michael Brooks. I'm the Vice Chairman of the Sullivan County Legislature, and welcome to our Town Hall event today. On behalf of our Chairman, Robert Doherty, and the rest of the Sullivan County Legislature, we welcome our County Manager, Joshua Potosek, our Director of Public Health, Nancy McGraw, and our guest today is the CEO of Catskill Regional Medical Center, Jonathan Schiller. Today we're going to start with Jonathan. He's got a few comments he would like to share with the residents of Sullivan County. Jonathan?
Thank you, Vice Chairman Brooks. A couple of updates with regard to Catskill Regional Medical Center. I think I should start with some great news. We are still in our emergency operations mode, but we've been able to reduce that to a level 1, which is the lowest level of operations mode that we have at the hospital. We are still treating patients with COVID-19. You can see the data online with regard to the 16 patients who are in-house, and those are 16 community members who are very ill. So we pray for them and we pray for their families. If you come to the hospital, you will still see our respiratory triage tent that is outside the emergency department, and that is for everybody's safety. And visitation is still restricted, also for everybody's safety. There are some exceptions to that, and if anyone has questions, they can contact the hospital with regard to visitation. Some other good news, we were able to safely resume elective surgeries and procedures 2 weeks ago. We did put some protocols in place for the safety of patients and staff, which include the testing of patients who are going to have a procedure for COVID-19. And that has worked fantastic. Kudos to the doctors and nurses that helped put the new safety protocols in place. And all of this would not be possible without the incredible support of our community, which we greatly appreciate.
Thank you, Jonathan. Good to see you, and we actually have a couple questions later on in the town hall that Jonathan will help answer. Now we'll go to our first question, as we always start, and it's for Nancy. What are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested? Nancy, welcome.
Good afternoon. Our total dashboard has been updated to reflect this morning's numbers. So our total cases include 5 additional new cases, but those cases are in congregate settings, which include a nursing home and another setting. So we have no additional cases in the community, which is good as of from yesterday to today. So total cases are 1,339 to date, and of those, 252 are actively being monitored and are in isolation. 2,491 are currently off of isolation and recovering. 823 in mandatory quarantine. 30 deaths so far to date, so that was 1 additional death over the weekend of a nursing home resident, and 16 currently in the hospital.
Okay, thank you, Nancy. Okay, next question. I will answer, and it reads, why is the sheriff planning to move county jail inmates to the new facility while they are in the middle of an outbreak of COVID-19? Wouldn't it make more sense to treat those who are currently infected prior to moving them into the new clean jail? We reached out to the sheriff's department, and this is the answer they provided. The COVID-19 patients have been treated and are about to come off quarantine. The new facility provides more protection and better opportunities to keep people separated as well. The new jail is a much safer place than the old jail. And having visited the old jail and the new jail, that last statement couldn't be more accurate, that the new jail is a much, much safer place. So that's that question. The next question is for Josh. Have you heard anything from the state regarding whether summer camps will be allowed to open?
Thanks, Mike. Good afternoon. A repeated question we keep fielding here, both from the press and from the residents on camps. So no, we haven't heard official word from the state on day camps. We've heard some rumors, and I have yet to see it in writing, but that overnight camps will be prohibited. Recently, the Empire State Development determined that campgrounds are deemed essential, similar to other lodging establishments, tenting sites, RV parks, and the like. So Day camps and overnight camps, we're still waiting guidance and determination from the state on, and it's something that comes up on the daily regional control room calls that I'm part of, and the state repeatedly keeps saying it's forthcoming and it should be coming out soon. But it's something that the region and the leaders are pressing them on how they can open. We are, as a county, working with the camp owners on how, if they are allowed to open, how they could do that safely. And we've seen some of their plans and are generally pleased with what they've kind of thought through using CDC guidance and the American Camp Association. So I think there is progress made on being able to open them safely if the state determines they can do such.
Thanks, Josh. We have a string of questions that are for our county manager. Next one, Josh. How is Phase 1 going in Sullivan County? What businesses have reopened or restarted work?
So it's generally been going well since Tuesday when we were allowed to reopen. It's the industries that were allowed to reopen that weren't deemed essential when we were on pause are those businesses in construction, agricultural, retail, for curbside pickup only, and manufacturing and wholesale trade. So we're monitoring the control room reports coming from the state on potential violations, and generally they've been unfounded, or with some dialogue we've been able to address those potential violations. So it's generally going well. There hasn't been, the businesses have taken the required precautions and have been working with the county and other economic development officials to kind of figure out how to open safely and do so in a safe manner. So it's generally been going well in 99% of the cases.
Okay. Next question, Josh. When will Phase 2 begin in Sullivan County? And what will what will reopen then?
So the regional control room has been using the 14-day period between phases for reopening. So a 14-day from Tuesday, this past Tuesday would be June 9th. The industries that would reopen in Phase 2 that weren't deemed essential, again, under the pause, would be those in the professional services, finance and insurance, retail, for not just store curbside pickup, but actual being able to go into stores for retail, administrative support, and various real estate businesses would also be allowed to be reopened. So again, we're looking at June 9th, assuming we meet all of the metrics and don't have spikes in any one of those 7 metrics that are required to continue to progress through the phases.
Okay, next question is also for Josh. When will government services reopen, like DMV, family court, the county clerk's office, office for the aging, and transportation?
So yeah, it's a great question. Something we're actively working on a department by department look. So obviously some of these offices that were referenced, such as DMV, family court, are governed by various state agencies. Office of Court Administration for family court, the state DMV for DMV. So we're looking at them on a case-by-case basis. Our first priority has been our Board of Elections. They're required to have early voting in the next couple of weeks in the Government Center as our early voting site. So that's been our number one priority in the recent past. We're also looking at the clerk's office, working with family court. They're starting to bring back staff into the court system, not for public, but they are starting to bring staff back. So we've been working with OCA, Public Works, IT, and how to get them back open safely. Aging and transportation not as heavily regulated by the state or federal government, so we're looking at certain services there, medical transports for aging, to see how we can do that safely. Obviously, we'd have to limit the number of passengers in vehicles, but are looking at how we could do that on a limited scale going forward. We're hopeful to have offices opening up kind of in tandem with Phase 2 and 3 of the reopening plan. When you're looking at professional services, finance, insurance, we're kind of aligning ourselves with some of those dates and looking to have public being able to access those certain offices kind of in tandem with the Phase 2 and potentially Phase 3 reopening.
Okay, thanks, Josh. Next question is for Nancy. Do you still need contact tracers? And if so, how do I sign up?
Hello. We're in pretty good shape for contact tracers, but we continue to encourage people to take the training and to sign up if you're interested. One of the things that we're watching very closely is if any region of the state, including Sullivan County, has an increase in the number of cases, we would need to pull down from a pool of contact tracers who are already trained and be ready to assist us with any surge capacity. So we have posted that information about how to sign up on our Facebook page, Sullivan County Public Health. It's also on our website. You can also go to coronavirus.health.ny.gov. And all the information is there in terms of what different roles and jobs are available. That is the hiring and interviewing is done by the state who has a vendor called PCG. And the training is free and it's online. The one other thing that I wanted to mention is that we have another testing clinic tomorrow in Liberty, and that is on Darby Lane across from the Elks. And the information is also on our website. You can call Public Health. You would have to do so very soon today in order to get registered for tomorrow, 292-5910. We also have another clinic the following Friday in Woodridge, and that information is also on our website. So just give us a call if you have any questions. Thank you.
Thank you, Nancy. Our next question is for Jonathan. Is CRMC still doing COVID testing, and is it open to the public?
Thank you, Michael. Yes, Catskill Regional Medical Center still does offer COVID-19 testing. Like any testing performed at the hospital, it does need to be ordered by a physician or provider. So we do encourage any members of the public who may feel like they've been exposed or have some type of a symptom to contact their provider before coming in for testing. Secondarily, if there is anyone who is acutely ill, by all means, please do come to the emergency department. We can care for you safely and perform a test while you're in our care.
Thank you, Jonathan. And the next question is going to be answered by Josh first, and then Jonathan will add a little something after Josh. And it reads, how is the hospital and the county preparing for a potential second wave of coronavirus, especially if it happens during the summer when our population is much larger? Josh first.
Thanks. Just take a moment to thank Jonathan and his whole team for what they've been able to do during this virus and kind of working with our public health department, our EOC. It's been a real true team effort on that front. So just kudos to them and thank them for what they've done. I mean, obviously on our side, the county side, it's our public health department takes the lead in a lot of any kind of virus response, whether it's measles or COVID-19. So I think we've gone through a couple tough months, but I think a lot of lessons have been learned, and I think we're much better prepared for if there is a second wave. I mean, just Nancy mentioned the contact tracers. I mean, I'd just like to thank, we had near 100 county employees that signed up to take the certification. So I think we've kind of all stepped up to outside of public health, and public health has taken the lead, obviously, but there's been a real support from a wide swath of employees across various departments that recognize the need, and contact tracing is important to kind of keep the virus from spreading as we reopen, and it's vital to get our economy reopening. So I just want to thank all those employees. And I said, without the hospital, a lot of this would be tough. I mean, Jonathan can speak to what they're preparing for, but working with public health and this CRMC, I think we're much better positioned for a potential uptick again in the virus.
Jonathan?
Thank you. Thank you, Joshua. I echo those comments, and certainly the powership, the collaboration and work that we've been able to do together is a very powerful relationship for both parties and really to benefit to the community. So we are, as I had mentioned, we are still in our emergency operations mode, although we're in the lowest level right now, and that will help us keep us in a ready position, if you will, if we do see an influx of cases over the summer. As an industry, as a county, and as a hospital, we're a lot smarter than we were. We have a tremendous amount of experience now dealing with the coronavirus and the COVID-19, and in the best way to care for patients and keep everybody safe. And one thing that we do every summer, and we just finished up this morning, is ensuring we have a very strong staffing plan for our emergency department and some of our other services that are highly utilized in the summer. And that staffing plan goes into effect in 2 weeks and will run through Labor Day. So we'll be ready should we have an influx of patients.
Okay, thank you, Jonathan. Okay, next question is for, I'm going to answer, and it reads, I want to help, but I can't make masks or volunteer. What can I do? Well, simply stated, you can donate money and or food to your local pantry. Now, the county, under its Family Services, Health and Family Services tab, has got a complete listing of all the local food pantries. So please check that out, and if you can do so, please do. Actually, I missed a question. So I'm going to go back to Josh, and the question reads, are you still making deliveries of food and medicine? How do I get on that list? Josh?
Well, the simple answer to the first part is yes, we are still making deliveries of food and medicine. If you would like to get on that list, we still have are staffing the Emergency Community Assistance Group. You can contact them at 807-0925, and they can get you on that list and get the services you need.
Okay. Our last question today reads, especially with coronavirus keeping us all at home, when will the county begin offering the broadband wireless service it's been talking about? I'll have Josh answer that, and then I'll do a follow-up. Joshua?
Another great question. So we have equipment ordered for our tower that's located near our Sullivan County Jail. That equipment should be starting to be hung here in the summer months. We'll do pilot testing of that through the latter part of the summer into the fall, with the goal of having that going live around the new year. We are also doing propagation studies on the roughly 10 other towers that the county has constructed for the radio interoperability project. Hopefully that has some good results that we can start hanging equipment on those other towers that we own. And we're also in dialogue with some of the private providers of towers to see if there'd be a willingness to allow us to come on some of their towers. So there could be, depending on how the Village of Monticello project goes, there could be next year a pretty strong push to develop and deploy this in a lot of other of our communities.
Thanks, Josh. And I'm sure most of you have heard this broadband is in this legislative term, is the single biggest priority for this group. And what we're going through now with this pandemic has definitely shone a light on the shortcomings when you don't have broadband, whether it be for education or health. It helps with businesses, being able to work at home. The effects of not having broadband are very far-reaching, and it certainly is one of those things that will help Sullivan County move forward economically if we can get broadband more widespread through the county. A lot of times that's much easier said than done. Just the sheer geographics of Sullivan County make it very difficult. This legislature has looked at basically 3 avenues for communication. It's the public safety with the radios. We have holes that we're trying to fill. There's also cell service that is sporadic throughout the county. We all know about that. And then there is the broadband service that Josh alluded to, and that broadband service is a wireless-based service, which will help us get beyond the terrestrial, if you will, obstacles that we face with the cost to run the cable, the pole permits needed, and the pole permits, that's another, it's something that's not talked about much, but that is a issue when you have a provider that wants to come in and expand service. That is a very cumbersome, it takes a long time to get those permits in place. And so it's something that at the end of this year you'll start to see some movement with the broadband, and next year should be a very exciting year for Sullivan County when it comes to broadband access. We can never get to 100%, but we're sure going to try and get most of Sullivan County covered. And the county owns 11 towers, Josh?
Yeah, 10.
10. And that helps us get a jump start this process. And we are, as far as cell service, we've are in the very early stages of getting a tower put in Rock Hill, and it's long overdue. And recently we had Verizon come online up in Roscoe, so it helped some areas up there. So, like I said, it's tough because of just the sheer geography of our county. So, but it's we feel confident on the legislature by the end of our first term that broadband will be much more widespread in the county. Cell service will be much more widespread in the county, and we will work towards making the public safety aspect more far-reaching than it currently is. So with that being said, that is the end of our question and answer today. Wanted to mention, like I have in the past, if you have not filled out the census yet, please do. We're still lagging. We really need the census to be filled out. And as we start to reopen, that it's important to remember the wearing of the face mask when you cannot maintain the proper social distance, wash your hands, all those things we've talked about in the past. I'm dating myself a little bit, but when there was a president that made a comment, and I'm paraphrasing, that when the government knocks on your door and says, I'm from the government and I'm here to help, then you should run. I think there's a little bit of truth in that, because I'm ever the optimist that people will do the right thing, as they have overwhelmingly. It can never be 100%, nothing in life is, but I have a lot of faith in people doing the right thing, and they've shown it time and time again. And our previous questions regarding donation of food and money just goes to that thought. In the last week's town hall on Thursday, somebody was nice enough to notice I got a haircut, and thank you for noticing, by the way. My wife got tired of seeing me with my long locks, so to speak, and she got me early one morning and shaved me. And for better or worse, as the saying goes, I got my hair cut. So anyway, with that being said, thank you for everyone for joining us today. Keep sending your questions. Be safe. Bye for now.